Hello to everyone. This is Dr. Yuvraj Singh from Positive Physiotherapy, and this is our first attempt actually to make patient education videos. And today we are going to talk about something which is very common to all of us, which is low back pain. This video has been brought to you by Positive Physiotherapy in conjunction with Heal Care Physiotherapy Clinic at Kharghar. So lots of us suffer from low back pain. In fact, almost 80% of the population at some point of time will suffer from low back pain. So basically, you're not alone. Okay, almost four out of five people are going to have disabling low back pain at some point of your time. So nothing to worry. It's a common thing. What it is, the good thing is most of these pains get better without needing any medical treatment. So most of these people with pain will get better without actually meeting their doctor. The problem lies is that almost 30% of these people will have reoccurrence. That means to say that they will keep on getting recurrent low back pain, and this is the problem. Is that we need to discuss. These are those people who generally need help, who need medical help because they will keep on getting low back pain again and again. Now, what causes low back pain? That is one question which we always ask. Is the thing. Okay, so spine. The human spine is a wonderful organ which is meant to bend, to dance, to play sports, to jump. You can run. You can do Zumba. Everything is permitted by the human spine, and it is one of the most strongest organ in the human body. And this is possible because of a wonderful interplay of your muscles, your bones, of the fascia which covers your muscles, the intervertebral disc, the various ligaments of the spine, the various spinal nerves which exit from the vertebral column, and they interplay together. Of course, they are controlled by the brain. So basically, what I mean to say is that any of these structures, either the muscles, the intervertebral disc, the nerves, the ligaments, if they get injured, they can lead to low back pain. What is important to note is that apart from the structures which we just discussed, which lead to low back pain, there are other very important factors which we have now identified which contribute heavily to development of low back pain. These are factors such as stress, sleep deprivation, prolonged desk work, and lack of general fitness. One important thing is that when we talk about low back pain and especially about mechanical low back pain, it is important to learn to the wise words of this person called as Dr. Alf Nachimson, and he was an orthopedic surgeon who studied his entire life, dedicated his entire life to research around low back pain, and he had once very uh, cunningly said that I have been studying low back pain for the last 50 years, and if anyone says they know where the pain is coming from, that they are full of shit. So basically, Dr. Alf was trying to tell us that although your doctors, your therapist may have different ideas, may have different theoretical models, it's very difficult to actually pinpoint the exact cause of low back pain. But that doesn't mean that your doctor or your therapist are not going to be able to help you. What will happen is that when you visit your doctor or your therapist, they will categorize you in any of the following three categories. Category one are the red flags. Okay, that is red flags means if you have these signs, it's a kind of a medical emergency. You have to immediately do further investigations, and you need your physicians and orthopedic surgeons to take actions. Example of, if you have low back pain along with fever or chills, it can mean an infection. If you fall down from a height and you have a low back pain, it could mean a fracture, and this would need to attention by orthopedic surgeon. Okay, constant pain at night, constant unexplained weight loss could mean cancer. Could mean there are certain cancers such as prostate cancer which have known to uh, refer metastasis to the spine, and this can cause low back pain. Okay, certain inflammatory disease such as ankylosing spondylitis are also known to cause low back pain. Yes, these are scary things, but the good thing is this happens in less than 1% of those who have low back pain. And if you have any of these signs along with your low back pain, that means it's time to immediately meet your physician or your orthopedic surgeon. The category two, the biggest category of all, and almost more than 90% of you will fall in this category, is that of mechanical low back pain. And This pain is caused by movements. It's something like bending or forward bending or lifting or getting up from chair, and the pain goes away with certain other movements. For example, if bending is painful, generally bending or extension will be pain relieving, or if you lie for some time, you will feel better. The pain comes and goes in spasms. Okay, it gets better through exercises or modifying your activities for a few days. It's a very very benign kind of a pain. The category 3 is your back pain with leg pain, or what is popularly known as sciatica. Also, at times it's a misnomer, but yeah, it is called a sciatica also at times. Okay, so this is leg dominant back pain, in which the leg pain is more than the back, and it is caused by spinal nerves which exit the vertebral column. When they get pressed, they cause this kind of a pain. There are two types of this kind of a pain. Type one is sciatica, which basically means a disc which presses on the spinal nerve, and this is almost a constant pain which you feel down your leg, accompanied by numbness or weakness of certain muscles. Category 2 is which is seen in generally the aged population, the elderly people, that is the lumbar canal stenosis. And this kind of a pain, this kind of patients will complain of pain which gets the leg pain gets worse when they walk or they stand for a long time. They will complain of heaviness in the legs. Okay, and this happens because of narrowing of the spinal canal due to degenerative changes. So basically, of all of you with low back pain, we can divide into three categories: the red flags, the mechanical low back pain, and the back pain with leg pain. If you have red flags, immediately meet your doctor. If you have back pain with leg pain, category 3, you have to meet your doctor. But the mechanical low back pain, the majority, the 90% plus category, wait for some time. There's a good news for you. Investigations. Okay, as we discussed, the category 1 and category 3 would need investigations. However, category 2, that is mechanical low back pain, generally do not need investigations such as the X-ray or the MRI scans or any other investigations. Many a times they are suggested to patients, and the changes which you see on your X-ray or MRI could just mean degenerative changes, could just mean age related changes. It is now known that almost 40% of people in their 20s and almost 50 to 80% of people in their 40s will show X-ray and MRI changes of reduced disc, of disc bulging, arthritic changes, and spinal stenosis. So we actually compare the changes on X-ray and MRI to gray hair. So if we think graying of hair is not a disease, you should not really think of finding small changes on your X-ray and MRI as a disease. These are normal age related changes, and you need not worry about them. They need not be the reason of your low back pain. Yes, and another thing, why these investigations are harmful. Of course, they are carrying a risk of radiation. There is a loss of time and money. But the biggest reason which I feel these investigations are harmful, because it creates a negative attitude. If you walk out of a doctor's clinic with a X-ray which shows slightly reduced disc, you might feel, oh, there is something wrong with me, there is some disease with me, and I don't know how would I go on with my life. Can I get back to sports? And this is a negative belief which people develop after they undergo X-ray or MRI and they are not counseled properly. So negative belief is one thing which we need to address. And that brings us to the next part, which is the yellow flags. Yellow flags are negative attitudes which we need to identify and challenge in patients with low back pain. A belief that back pain is harmful. I have been saying since the start of the presentation that most of back pain is benign, it goes away. So don't, so if there is someone who is fearing his back pain, someone who is depressed or is in low mood, there is a patient with back pain who has strong preference for passive therapies such as massage or acupuncture rather than trying to be active or get with exercises. These are the people whom we feel would need more help. And now there are specialists, for example, whom you can talk to. You can first, of course, talk to your doctor or your physiotherapist if you have any of these yellow flags. In extreme cases, you need to talk to other health experts such as a psychologist or psychiatrist. In case of treatment, it has changed drastically from the 1990s to 2020. 1990s, we used to prescribe a lot of medicines and rest for your low back pain, but it has changed now. Of course, let me just repeat again and again, stress on that point that if you have any red flags or there is a back pain with leg pain, you need to see a doctor or orthopedic surgeon. But people with mechanical low back pain, okay, you don't have to worry much. It's very important to keep moving. In fact, movement will make your low back pain better. Certain positions or certain movement may trigger your pain, and it's important to avoid those positions or movements for a few days. Exercises are very important, and exercises have shown to prevent reoccurrence of low back pain. Is one of the most useful tool, most potent tool to prevent reoccurrence of low back pain. So if you need to find the right exercises for you, you need to meet your physiotherapist. So in summary, you don't need to worry about your low back pain. It has an excellent prognosis and most of you will recover soon. Your back is an amazingly strong structure meant for bending, twisting and carrying weights. You might be injured right now, or we can say it is sensitized to certain movements, but very soon you should be able to get back to normal. Know your red flags, and if you have any of those, immediately meet your doctor. It's important to keep an eye on the attitude. Change your attitude towards pain. Don't fear it. Okay. Important to keep moving. Avoid long hours of sitting in front of the laptop, and that generally causes low back pain. It's important to exercise to strengthen your spine and stay fit. So exercises are very very crucial when it comes to managing low back pain. Yes, okay, that's thank you for listening to this video. And Positive Physiotherapy is located at two locations, one in Andheri East and one in Thane West. And Heal and Care Clinic is located in Navi Mumbai. If you have any queries regarding your low back pain, or if there is a friend who has low back pain, please share this video with him. Please don't forget to subscribe to our channel for more updates regarding patient education material, and contact us if you have any doubts. Thank you so much, guys.